Speaker, wishing his predecessor, the Right Honourable Member for Leicester South, all the very best in his new role too. Throughout this national effort, I've always been grateful for how this House has worked together across the floor in a constructive manner, and I look forward to that continuing. Madam Deputy Speaker, with permission, I'd like to make a statement on the pandemic. The Omicron variant is continuing to spread here and around the world. According to the latest data, there are now 261 confirmed cases in England, 71 in Scotland, and 4 in Wales, bringing the total number of confirmed cases across the UK to 336. This includes cases with no links to international travel, so we can conclude that there is now community transmission across multiple regions of England. Beyond our shores, confirmed Omicron cases have now been reported in 52 countries, with 11 countries that include Romania, Mexico, and Chile all reporting their first cases this weekend. This is a global battle, and we are playing a leading role. On Friday, I spoke with the Director General of the World Health Organization to share our findings so far and discuss how we can work together to tackle this common threat. We're learning more about this new variant all the time. Recent analysis from the UK Health Security Agency suggests that the window between infection and infectiousness may be shorter for the Omicron variant than for the Delta variant. But we don't yet have a complete picture of whether Omicron causes more severe disease or indeed how it interacts with the vaccines. And so we can't say for certain at this point whether Omicron has the potential to knock us off our road to recovery. Madam Deputy Speaker, we are leaving nothing to chance. Our strategy is to buy ourselves time and to strengthen our defences, while our world-leading scientists assess this new variant and what it means for our fight against COVID-19. And so today, I'd like to update the House on some of the latest measures that we are taking. First, we're taking balanced and proportionate measures at the border to slow the incursion of the new variant from abroad. We've seen with previous new variants how strong defences at the border, combined with the capacity we've built for genomic sequencing, can give us the best possible chance of identifying and responding to new variants. This includes our travel red list, which allows us to react quickly through targeted measures when the data shows cause for concern. Analysis from UKHSA shows that at least 21 Omicron cases in England alone are linked to travel from Nigeria, and there's a strong indication that Omicron is present there. Nigeria also has very strong travel links with South Africa, and it's the second most popular flight destination from Johannesburg. Based on this evidence, we've made the decision to add Nigeria to the travel red list, and this came into force at 4 a.m. this morning. This means that anyone who's not a UK or Irish citizen or a UK resident who's been in Nigeria for the past 10 days will be refused entry. Those who are, they must isolate in a government-approved facility for 10 days where they will take 2 PCR tests. I know that there's been a spike in demand for these facilities due to the rapid expansion of the red list, and that some people have experienced issues returning home. However, we are ramping up this capacity as quickly as possible. We've already brought several new hotels on board in the past few days, and we expect to double the number of rooms that are available this week. Madam Deputy Speaker, when this new variant is appearing in more and more countries every day, we also need to look beyond the red list and strengthen our measures for a wider range of travellers to make sure they give us the protection we need against this potential threat. UKHSA's findings that Omicron may have a shorter window between infection and infectiousness mean that pre-departure testing could have a greater role to play in identifying positive cases before travel. As a result of this new data and the greater spread of Omicron across the globe, from 4 a.m. tomorrow, anyone travelling to the UK from countries that are not on the red list must also show proof of a negative PCR or lateral flow test. This applies to any vaccinated travellers, so whether you're vaccinated or unvaccinated, and anyone aged 12 and above. They should take tests as soon as possible to when they depart, but no earlier than 48 hours before. I know that these measures, of course, they will bring disruption and that they will impact people's plans to spend time with their loved ones, especially over this festive period. But we're taking this early action now so we don't have to take tougher action later on, and so that we can take every opportunity to prevent more cases from arriving in our country. I'd like to reinforce to honourable members that these are temporary measures while we improve our understanding of this new variant. We'll be reviewing these measures along with other temporary measures that we've announced, and we will update the House next week. I firmly believe that whenever we put in place curbs on people's freedoms, we must make sure that they are absolutely necessary. And I can assure the House that we won't keep these measures in place for a day longer than we have to. Second, Madam Deputy Speaker, as well as acting to slow the incursion of the variant from abroad, we're also strengthening our vital defences here at home. Late last week, we had the brilliant news that another new treatment has been approved by the MHRA after it was found to have reduced hospitalisation and death in high-risk adults with symptomatic COVID-19 by 79%. Another defence, of course, is our vaccination programme. On Saturday, we recorded almost 450,000 booster jabs in a single day, and yesterday, we announced that we'd hit the significant milestone of 20 million booster doses and third doses across the United Kingdom. In the last week, the UK booster programme has reached more people than the adult population of Greater Manchester, and we are expanding this life-saving programme even further as part of our target of offering all adults in England a COVID-19 booster jab by the end of January. To put this plan into action, we'll be recruiting 10,000 more paid vaccinators. We're also deploying about 350 military personnel in England this week to support the vaccine booster programme, and there's already over 100 personnel deployed in Scotland supporting their vaccination efforts. We'll have over 1,500 pharmacy sites putting jabs into arms across England, along with new hospital hubs and new vaccination centres. We're bolstering our booster programme so that we can protect as many people as possible, strengthening our collective defences as this virus goes on the advance this winter. Madam Deputy Speaker, one of the most dangerous aspects of COVID-19 is how quickly we can adapt. And when the virus adapts, we must adapt too. We cannot say for certain that Omicron what it means for our response, but we can say that we're doing everything in our power to strengthen our national defences. So we'll be as prepared as possible for whatever this virus brings. I commend this statement to the House.
Shadow Secretary of State for Health, Wes Streeting.
Thank you, Madam Deputy Speaker. And can I thank the Secretary of State both for his kind, warm words of welcome and for advance sight of his statement, and say how much I'm looking forward to our exchanges. Last week, I paid tribute to my right honourable friend, the member for Leicester South, and I do so again today, along with my honourable friends, the members for Ellesmere Port and Neston and Nottingham North, who did a magnificent job in the Shadow Health team. My right honourable friend took a constructive approach to the government's response to the pandemic, and I intend to continue in the same vein. COVID-19 is still with us, and with new variants presenting significant challenges to lives, livelihoods and our liberties. The goal must be to ensure that we can live with the virus through effective vaccines, treatments and common sense public health measures. In that spirit, can I welcome the announcements the Secretary of State has made today and join him in his call for everyone who is eligible to come forward and get the booster jab, as my right honourable and learned friend, the Leader of the Opposition, did just this morning. Vaccination remains the greatest tool we have in our fight against the pandemic. In order to achieve the government's overall target, they need to reach 500,000 booster vaccines a day. Labour called on the government to set the target, I believe they have, and we support it. And we desperately want the booster campaign to be successful. So can the Secretary of State today update us on when he expects to hit that target of 500,000 booster jabs a day? And can I ask when boosters will be rolled out to under 40s, and probably declare my interest in this, Madam Deputy Speaker, as I do. On the wider vaccine rollout, members across the House will have been frustrated and concerned with reports this weekend that too many hospital beds and resources are having to be diverted to those who have chosen not to receive the vaccine. With the pressures on the NHS this winter expected to reach unprecedented levels even before the emergence of Omicron, what is the Secretary of State's plan to persuade the 1 in 5 people who are eligible but not yet fully vaccinated to get the jab? The arguments in favour of receiving the vaccine are overwhelmingly strong. It is a safe and effective tool in our defence. So what research has the Secretary of State undertaken into the reasons for vaccine hesitancy, and what steps is he putting in place to put effective reassurance measures in place to encourage take-up, particularly among groups that are less likely to have taken up the vaccination and are disproportionately suffering with the virus? And can he update the House on the reasons for the slow progress in vaccinating 12 to 15-year-olds? The initial target of offering all 12 to 15-year-olds the vaccine by October half-term has been missed, with current trends suggesting some teenagers won't receive the vaccine until February. So what's the Secretary of State's plan to speed this up? Madam Deputy Speaker, we want everyone to be able to enjoy Christmas this year. To make that happen, the government needs to bring forward the common sense measures which can limit the spread of the new variant while having a minimal impact on our lives, jobs and businesses, especially in the busy pre-Christmas trading period. I was pleased to see the Secretary of State and his right honourable friend, the Home Secretary, accept Labour's call for the reintroduction of pre-departure tests for those travelling to the UK. But given the likelihood of new variants, will the government now introduce as a standard response to new variants overseas, introducing stronger border controls, testing and contact tracing so the government isn't again accused of locking the door after the horse has bolted? Can the Secretary of State explain why the window for pre-departure tests is 48 hours and not shorter? And can he act with his colleagues in government to address the racket of soaring testing costs and poor provision of hotel quarantine accommodation? Madam Deputy Speaker, SAGE recommended a year ago ventilation support for schools. The government's air purifiers in schools pilot isn't due to publish its full report until October next year. Meanwhile, a primary school in Paisley is today shut for a week following a suspected Omicron outbreak. In the past 2 weeks, the number of students missing school has increased by 62%, meaning disruption to their learning and an impact on their parents as they have to stay home with their children. Children have seen their education disrupted enough. So will he now roll out the ventilation support needed to protect our schools? Madam Deputy Speaker, we have one of the lowest levels of sick pay in Europe. Workers in low pay and insecure employment who contract COVID are still being put in the impossible position of choosing between going to work and feeding their family on one hand and staying at home and protecting our public health on the other. So can I ask the Secretary of State if the government will finally look again at increasing and expanding sick pay? And finally, Madam Deputy Speaker, and I'm sorry to have to end on this note, I'm sure the Secretary of State will agree with me that the effectiveness of the government's response to the pandemic and public compliance with the rules will depend on public confidence in those setting the rules. Residents in Ilford are this week being prosecuted for holding an indoor gathering of 2 or more people on the 18th of December 2020, and rightly so. Isn't it time that the government comes clean about the event in Downing Street on that same day, admit they broke the rules and apologise? Or does the Secretary of State believe, as the Prime Minister appears to, that it's one rule for them and another rule for everyone else?
Secretary of State.
First of all, Madam Deputy Speaker, can I thank the honourable gentleman for his support for these measures that I talked of in my statement. And I'm pleased to hear that the Leader of the Opposition has got his booster jab today, as I think also the Chief Executive of the NHS also received her booster jab today as well, along with thousands of many other people. And can I also thank him for his support, his general support for the booster program, the importance of vaccines, the call that he's just made for more and more people to come forward. The booster program itself is steaming ahead at a blistering pace. 2.6 million people across the UK were boosted last week. There's some 3.6 million people that are booked in to get their boost already. I think that's one of the highest numbers, probably is the highest number that we've seen, certainly for boosters. And I'm confident that we are on track to meet our commitment to offer all adults across the UK a booster jab by the end of January. We are already far ahead of any other country in Europe, and when we achieve that by the end of January, we most certainly still will be. In terms of vaccination more generally, especially those people who haven't even yet taken up their offer of a first vaccine jab, the honourable gentleman is right to point to the importance of that. We estimate there's around some 5 million people across the UK that have yet to take up their offer of a jab. Our general vaccination rate across the population, over 88% having had at least one jab over the age of 12, 88% is one of the highest in Europe, but we do need to do even more to get to that 12%, that missing 12%. There's a huge amount of work that's gone on that, especially around communications, especially around dealing with misleading information on vaccines, but also by improving access. And we have seen in the last week, perhaps because of the concerns around the Omicron variant, more and more people coming forward for vaccinations the first time. And of course, that is to be welcomed, and we will continue to build on that. The honourable gentleman also asked me about responses to any potential future variants. I think it's reasonable to think there will be future variants, but we will reserve judgment on those until we come across such issues. And in any case, there will always be a balanced and proportional response based on what we know at that time. I don't think it would make sense to set out that response in advance. The honourable gentleman asked me about testing, the testing cost, whether PCR tests, lateral flow tests. We have removed, rightly so, I think over 100 providers from the government website in recent weeks. I think some 20 were removed this weekend for offering, for showing misleading prices, and we will continue to take a tough and hard line, because no one, of course, should be misled in this, and the pricing and the availability should be absolutely clear. The honourable gentleman asked about ventilation in schools. I believe that my right honourable friend, the Education Secretary, gave further information on that and improvements that were being made. I believe he did that last week. On sick pay, I think it's important that we rightly have kept in place the access to sick pay from day one, rather than what was there before the pandemic. And in terms of rules, of course, they should apply to everyone, regardless of who they are.
Chair of the Health Select Committee, Jeremy Hunt.
Thank you, Madam Deputy Speaker. Can I strongly support the Secretary of State in the balanced and sensible way that he is buying time before we really find out how dangerous this new variant is. But can I ask him how he is preparing the NHS for the potential worst case scenario that we may be facing? In particular, the 10,000 NHS beds that NHS providers think are occupied by people waiting for a social care package. And also, given that in the first wave, we know that sadly, many people died at home from strokes and heart attacks because they didn't want to go into hospital. What are we doing for emergency care? And we also know that for cancer care, 45,000 fewer people started cancer treatment. So how will you make sure that when we switch the NHS on for Omicron, we don't switch other services off?
First of all, can I thank my right honourable friend for his support, and he is right to talk about the importance of buying time, and also the comments he's made about the NHS and the need to prepare. I can reassure him that ever since we discovered Omicron, the NHS has been spending a substantial amount of time in preparing. He mentioned the importance of discharges. That was important before, but where a patient is ready to be clinically discharged, I think it's become even more important now in light of Omicron, and the recent funding we provided, almost £500 million over this winter period for discharges, will certainly help.
SNP spokesperson, Dr. Philippa Whitford.
Thank you very much, Madam Deputy Speaker. As the Secretary of State highlights, we don't know about its severity, but Omicron mutations certainly suggest a risk of increased transmissibility and possible immune escape. However, it is expected that vaccines will still provide protection and hopefully from serious disease. So I just want to echo his call for people to get vaccinated if they haven't already done so. With S-gene dropout providing an early PCR marker for Omicron, can the Secretary of State clarify what proportion of labs in the UK assess the S-gene, and particularly of all the private labs providing travel testing are doing so, because obviously they are critical in defence of seeding cases into the UK? I welcome the logical reintroduction of a pre-travel PCR, but does he recognise that still the average incubation of COVID is 5 days? And does he not agree with the call from the Scottish and Welsh governments to have a day 8 test for release? Will the government now hold a 4-nation COBRA meeting to discuss the response? And will the government also commit to providing support for for the travel sector and any other businesses that might be impacted by public restrictions going forward. The Secretary of State described it as a global battle, and he's right. But the establishment of Omicron in the UK is a stark reminder of the failure of wealthy nations to take a global response as they promised last spring. While almost 90% of adults in the UK are doubly vaccinated, less than 4% in low-income countries have even had one dose, and less than a quarter of their healthcare staff are protected. The UK government promised to deliver 100 million doses by next summer, but has so far delivered less than 10 million and shamefully destroyed 600,000 doses in August. It's estimated the UK will be left with almost 100 million excess doses. So will this government not accelerate their donations to COVAX? And finally, Madam Deputy Speaker, 130 countries support the principle of waiving intellectual property rights and technological transfer to mount a global response to this pandemic. So why is the UK government blocking the TRIPS waiver when most of these vaccines were developed with millions of pounds of public money?
Secretary of State.
Thank you, Madam Deputy Speaker. First of all, can I thank the Honourable Lady for her support for vaccination in general, right across the UK. It's really making a difference, and I thank her for her comments on that and the importance, especially of the booster programme. In terms of testing for this variant, she talked about the proxy measure, which is the S-gene dropout. But there are other methods that UX have also started deploying alongside that, which stops short of sequencing, which does take much longer, and there's not universal capability of that. And between these two proxy methods, the majority of testing centres can pick up the potential marker for Omicron, but we are expanding that as well, so that all testing centres will be able to do it very soon. In terms of the Honourable Lady talked about the restrictions, I would just point her to one of the important points I made earlier about the restrictions are temporary. As soon as they can be removed, we will, and I think that's what industry and others would want to see, that as soon as we don't need them, we can remove them without any delay. And in terms of vaccine donations, I think the UK can be proud of its commitment to vaccine donations to the developing world. We've got a commitment of 100 million by June 2022. We've already delivered 22 million to COVAX, and bilaterally there's another 9 million on its way in the next couple of weeks, and we will meet our commitment.
Ms. Theresa May.
Thank you, Madam Deputy Speaker. The early indications of Omicron are that it is more transmissible, but potentially leads to less serious illness than other variants. I understand that would be the normal progress of a virus. Variants will continue to appear year after year. When is the government going to accept that learning to live with COVID, which we all have to do, means we will almost certainly have an annual vaccine, and that we cannot respond to new variants by stopping and starting sectors of our economy, which leads to businesses going under and jobs being lost?
Madam Deputy, I think my right honourable friend makes a very important set of points. And first of all, I think she's right about the early data, what it suggests about transmissibility. We are certainly seeing that here in the UK, and from the reports we're seeing from our friends across the world. In terms of the severity of this, I think we shouldn't jump to any conclusion. We just don't have enough data. So the most of the data that is available at this point in time is coming from South Africa. That's where most of the world's cases are. And it is important, I think, to remember it's a younger population, and they also in South Africa had the beta wave, and beta as a variant is much closer to this variant, the Omicron variant. So whilst it's quite possible there will be a difference into the clinical outcome from infection, I think it's too early to jump to conclusions. But she is right about her final point. Of course, we have to live to learn with this virus. It is not going away, as my right honourable friend says, for many, many years, and perhaps it will lead to annual vaccinations. But we have to find ways to continue with life as normal.
The colleagues will be aware that there is a further statement and quite a lot of business to get through this evening. So I will be looking, if I'm to get everybody in, for brief questions and brief answers. Clive Betts.
Thank you, Madam Deputy Speaker. I'd like to refer the Secretary of State to the issue of third doses and welcome the government's policy to give people with compromised immune system a third dose, and I declare my own interest in that. Could I ask the Secretary of State, why is there so much confusion around who is responsible for advising people of an entitlement to a third dose? A lot of confusion between secondary care and primary care providers. And secondly, why is it not possible to go online and book an appointment for a third dose as it is to book one for a first, a second or a booster dose?
Secretary of State.
Madam Deputy Speaker, I can tell the honourable gentleman the reason why it's not possible to go online to do that is that to receive a third dose, it's often the case that the clinician, often the GP, will need to make a judgment on that particular individual. A lot of cases are different, and it depends a lot of the times on the reason why that individual is immunosuppressed. It could be for a temporary reason, it could be a long-term issue, and it also depends a lot whether that individual has had any other recent infection. So it is a clinical decision. I think it's right that it's made by GPs, but as soon as that decision is made by the responsible clinician, of course that person should get their third dose as soon as possible.
Dr. Liam Fox.
Madam Deputy Speaker, many of us have constituents who were caught out when South Africa was added to the red list and are now in compulsory hotel quarantine. Given the information that my right honourable friend gave us today, if someone has had a negative PCR before travel and a negative day 2 PCR, what is the medical rationale for retaining 10-day quarantines? And is it possible to find ways of having safe early release so we're not using up the capacity that we have unnecessarily?
Secretary of State.
Madam Speaker, the medical rationale is around the incubation period of the virus. And of course, most of the data we have today is based on previous variants that we've had time to assess. With this particular variant, as my right honourable friend will know, there hasn't been enough time so far. But as we learn more, should we need to change our policies, of course we will.
Vicky Foxcroft.
Thank you, Madam Deputy Speaker. Last week, I asked the Minister for Vaccines and Public Health if the government would allow immunocompromised people the opportunity to have antibody tests. She helpfully said she would look into this. Has the Secretary of State discussed this with her? And what are his thoughts on antibody testing for those people that we don't yet know if the vaccine works on them?
Secretary of State.
Madam Deputy Speaker, I believe in certain conditions, immunocompromised people can have antibody tests. It's a decision made by their clinicians. I think the honourable lady is asking, can it be made available more generally? We are taking expert advice on that, but also I do want to reassure her in terms of more support for the immunosuppressed. Some of the recent treatments that we have both purchased and that are being authorised by the MHRA will also provide a much higher degree of support.
Villiers.
The travel sector has been devastated by 2 years of COVID emergency. They'll have met with despair, new expensive testing requirements and a collapse in confidence by people who would otherwise be booking their holidays. What are we going to do to help the travel sector? And when are we going to get to a stage where we deal with COVID without having to damage so significantly important parts of our economy?
Secretary of State.
Madam Speaker, my right honourable friend is right to talk about the challenge that's the particularly acute challenge there for the travel sector, because not just the measures that have been taken here at home, but of course the travel sector has been hit hard because the international measures that have been taken by so many countries, not just the UK-based decisions. I think that the answer really lies in making a quick decision about Omicron, and she'll know that, as I've said in my statement earlier, that we will update the House and hopefully have much more data on it by next week. And hopefully, if that data is helpful, that things pressures can be eased in the travel sector. And should it be less helpful for the travel sector, the government will have time to review what other measures it might be able to take to help.
Henry Ben.
Thank you very much indeed, Madam Deputy Speaker. Current government guidance is that if someone has tested positive for COVID, they should not, in England, they should not have another PCR or lateral flow test for 90 days. And yet the guidance for those wishing to return to the UK is that if they've recently recovered from COVID and are no longer infectious, they should have a lateral flow test, apparently, because it is less likely to return a positive result. This is apparently contradictory advice, and I'm grateful to the Secretary of State to tell the House what advice he can give to UK citizens who've caught and recovered from COVID abroad about how they can best return to the UK in time for Christmas.
Secretary of State.
What I will tell the right honourable gentleman, that for UK citizens that are abroad wishing to return home, they should of course comply with the requirements. But he's raised an important issue, and so I will take that away and look into it further.
Mark Harper.
Thank you very much, Madam Deputy Speaker. I know you'll find it as comforting as I did that the Prime Minister's official spokesman this morning confirmed that next week the government was confident it would have more data than it currently does, and that the government would update Parliament before the House rises for Christmas. That is very welcome. But can I ask the Secretary of State, the Prime Minister's official spokesman also reserved the right to implement measures, if necessary, during the recess. Now, I think that's perfectly reasonable that the government retains that power. But I also think that if things are important enough to implement restrictions during the recess, then it means the House should be recalled for us to debate and vote on those matters. Can I have an assurance from the Secretary of State that that's what will happen?
Secretary of State.
Madam Deputy Speaker, my right honourable friend, first of all, you should be reassured that there will be a further update next week, as I've also just committed to. And as he says, if and it is a big if it was necessary for the government to take important action during the recess, of course, I think people would expect the government to take that. And as for whether Parliament should or should not be recalled, that is something that I will take back to my right honourable friend.
Dame Angela Eagle.
Thank you very much, Madam Deputy Speaker. Could the Health Secretary confirm that next week's update, he expects next week's update to contain much more information about the threat that the Omicron variant actually poses in terms of seriousness of illness, so that we can have some insight into that? And would he tell us if he's not expecting that to be the case now? And can he comment on the fact that over 25% of the members opposite who are in the chamber today aren't wearing masks? And will he say what this does for compliance of people outside who are now meant to wear masks on public transport and in shops?
Secretary of State.
Madam Deputy Speaker, as each day goes by, we are getting a little bit more information, but I do think by next week, with the samples that arrived at Porton Down and other labs across the world, we will have more information. I will just, though, caveat that by saying that I can't make any guarantee about how much information that we will have. I'm sure there will still be many unanswered questions at that point. And as for masks, our rules on masks are clear.
Eric Baldwin.
Thank you, Madam Deputy Speaker. And can I welcome the emphasis the Secretary of State has put on vaccinations and boosters in his statement today, and not on locking down the economy. I wonder if he, as a fellow Worcestershire MP, is aware that in very rural parts of Worcestershire, certainly, for example, Tenbury Wells in West Worcestershire, it's a long way to travel on occasion to get a booster jab, and also that home visits for people who have care at home can also be difficult to access. And could he suggest to the system that we put more emphasis on those rural deliveries of booster jabs?
Secretary of State.
Yes, Madam Deputy, I can give my honourable friend that reassurance that we are massively expanding the availability of vaccines. That process has already begun in the last week or so, with more pharmacies coming on board, many of them in rural areas, many of them in the heart of the communities, with more hospital hubs and more vaccination centres. And we are recruiting some 10,000 paid vaccinators to help us do just that.
David Linden.
Thank you very much, Madam Deputy Speaker. Whilst it will still take another couple of weeks to fully understand the impact of the Omicron variant, we do know that this strain of Covid-19 is considerably more transmissible. As a result, it is reasonable, I'm sure, to expect more people to be pinged or asked to self-isolate. So in light of this, will the government now bring forward urgent reforms to increase and extend statutory sick pay so that workers aren't forced into poverty as well as self-isolation?
Secretary of State.
Madam Deputy Speaker, to support people that may have the challenges that the honourable gentleman referred to, first, the sick pay will begin on day one, and secondly, we also have the hardship fund that can help with particular cases.
Sir Graham Brady.
Thank you, Madam Deputy Speaker. Can I say to my right honourable friend that the travel sector has been devastated by uncertainty and by constantly changing rules. I welcome the fact he said these measures are temporary, but will he also set out in detail what the criteria are by which he will make the decision on whether they should be lifted and when?
Secretary of State.
Madam Deputy Speaker, I fully understand the point that my right honourable friend has made about the impact on the travel sector, and that should be not lost on anyone. So I think we all understand why the action has been taken, but we mustn't forget this is a really important part of the economy, a hugely important sector. It has been hit hard again and again. And in terms of providing more certainty, I think next week's update will be important. The review point, as I said to the honourable lady earlier, we can't guarantee we'll have all the answers to the questions that we have, but I think that information will certainly help to give more certainty.
Barbara Keeley.
Thank you, Madam Deputy Speaker. I've got a constituent whose mother has been fast-tracked for end-of-life nursing care in a local care home. However, my constituent was told she would not be able to visit her mother at Christmas, despite this being her last Christmas. The reason the care home gave for suspending visits on Christmas Day was to make it easier for the staff, because the COVID testing would be too time-consuming. And that just flies in the face of government guidance, which says visits at the end of life should always be supported in the final months and weeks of life, not just the final days or hours. So can the Secretary of State issue guidance to care homes, emphasising the importance of visits at Christmas, particularly for people at the end of life?
Secretary of State.
Yes, Madam Deputy, I will most certainly like to help with that. I'm sorry to hear about her constituent. As the honourable lady says, that visits at end of life should always be made available. There should be no excuses for that. And I'll be first happy to look into the case that she's mentioned if you provide me more details, but I'll also check the general guidance.
Sir John Redwood.
Why hasn't some of the substantial extra money for the health service been used to expand bed and associated staff capacity in hospitals? And why weren't the anti-COVID Nightingale hospitals used for the pandemic to prevent it being spread to the district generals?
Secretary of State.
Madam Deputy Speaker, I can tell my right honourable friend that a lot of the funding for the NHS, for NHS and social care over the second half of this financial year is £5.4 billion of extra funding. And a lot of that is being deployed to create extra capacity, especially between work between the NHS and the social care sector, especially when it comes to discharges. So these people that are ready clinically to be discharged, but the care packages haven't always been easily available, and the funding, a lot of it is going to support that.
Sir Desmond Swain.
How many of those who have tested positive in the UK are ill?
Secretary of State.
The number of confirmed cases in the UK is 336. They are all by definition infected. They will have been various, some may be asymptomatic, others will be feeling ill. None of them so far And the Honourable Lady will also understand that some countries, they don't have the same ability to test or sequence, and so we provide them with other countries with that support. But I do think is it appropriate, it is right that whenever we have the data, we must act to protect British public health.
Steve Brown.
Very much, Madam Deputy Speaker. As feared last week, my constituency, like many others, I'm sure, is seeing Christmas events cancelled, moved online, and that includes all manner of festive performances in school. Local authority guidance is often what's quoted. So I'm really keen to understand, given national government has gone out of its way last week to ask schools to go ahead with Christmas performances, to go ahead with nativity plays, who should head teachers and other event organisers follow? The town hall or this place?
Can I just once again urge brevity if we want to get everybody in? Secretary of State.
Madam Speaker, I would encourage everyone to look seriously at the national government guidance. Our guidance is clear, and even before the emergence of this new variant, we all knew that the variant, that COVID-19 likes the colder, darker days that winter brings, and there's plenty of guidance there. And I would encourage people to go ahead with whether it's nativity plays or Christmas parties, but just continue to follow the guidance that was always there.
Graham Morris.
Thank you very much, Madam Deputy Speaker. The recent, quite staggering figures from the respected charity Macmillan show nearly 50,000 people in the UK are still missing a cancer diagnosis compared to the pre-pandemic period. I know the Minister's new to his post, but there's a whole weight of evidence, petitions, letters from MPs. Will the Minister commit to address the severe capacity pressures within cancer services in the imminent elective recovery plan?
Secretary of State.
Yes.
Suzanne Webb.
Thank you, Madam Deputy Speaker. Does my right honourable friend agree with me? The best Christmas present anyone can go and get this year is to go and get your booster jab.
Secretary of State.
Yes, yes.
Commissioner Allen.
Thank you, Madam Deputy Speaker. Can the Health Secretary update the House on whether we should expect an economic support package, not just for the aviation sector, but also the tourism and other sectors that might be affected if further restrictions apply? And also, can you say more about how we can ensure that the COVID vaccine, which is a global public good, can be accelerated so that countries that are at risk get the support they need? Because if we had acted faster, earlier, we might have prevented having this particular variant, and we need much more international leadership led by our government.
Madam Speaker, on vaccine donations, I think I would just refer the Honourable Lady to the answer I gave to a similar question a moment ago. In terms of transport, I would also refer her to an answer I gave moments ago.
Sir Sims.
My constituents, Mike and Carol Parking, are paying $2,700 for the privilege of being imprisoned in the Delta Hotel, Milton Keynes. My constituent, David Brayshaw, took $3,700 for being in the 3-star hotel in downtown Hounslow. The highlight of the day are meals in boxes with plastic cutlery, which are either unedible or cold or both. Can we really go back to a proper quarantine where people can go home? What they're getting is very poor value indeed.
You state.
My honourable friend Mandis will understand. I think he will understand the difference in terms of public health between a managed quarantine facility and home quarantine. But he's right to really point to what is an important issue. Of course, no one's going to enjoy or want to be. Why would anyone want to choose to be quarantined in this way? I think everyone understands the issues, but it is really important that the quality of care that they provide there is as decent and of good quality. And if he can share with me some of the information he has about his constituents, I would like to look into that.
Dr. Lisa Cameron.
Many thanks, Madam Deputy Speaker. As Chair of the Disability All-Party Parliamentary Group, I've been hearing from people right across the United Kingdom to say that some of the individuals who have not yet been vaccinated have learning disabilities or autistic spectrum disorder, have a fear of going to large-scale vaccination centres, but don't yet have adapted vaccination regimes such as specialist learning disabilities, nurses who can attend to them. So could the Secretary of State assure the House that this will be taken forward and that the most clinically vulnerable will not be left behind?
Madam Speaker, I think it's a really important point the Honourable Lady has just raised. it is important that there is easy access for everyone to get vaccinated. And she's made a really good demonstration why that is so critical for every part of our community. The vaccines minister, if it's helpful, would be pleased to meet with her as the chair of the APPG and see what more we can do.
Dr. Andrew Morrison.
Thank you, Madam Deputy Speaker. Vaccines are clearly our way out of this, but would you agree with me that treatments are also important and they come on in leaps and bounds? Sotrovimab reduces the instance of death or hospitalisation 80%, and Molnupiravir got its approval last week. Would you agree with me that whilst we're very good at R&D, we're less good at rolling out these extraordinary therapeutics? And would you do everything in his power to make sure that the NHS has access to those drugs as soon as possible, since they reduce considerably the problem that COVID and its associates will pose in terms of mortality and serious illness?
Yes, no, my honourable friend speaks with experience, and I agree with him absolutely.
Clive Bedford.
Thank you, Madam Deputy Speaker. If we're going to have to live with COVID, given the high level of infection rates we have amongst young children, what possible justification can there be for delaying funding to schools to improve ventilation to reduce transmission?
Secretary of State.
I believe that my right honourable friend, the Education Secretary, said something about ventilation, the importance of it last week.
Holly Mumby-Croft.
Thank you, Madam Deputy Speaker. Many of my constituents in the Scunthorpe constituency have come forward and had their jabs and their boosters, and I hope my honourable friend will thank them as I do. But I still speak to a very small number, particularly of younger people who are sincerely worried about having the vaccine. What can he do to reassure them that it's safe and effective and they should come forward and take the opportunity to have theirs?
Secretary of State.
It's important that we do whatever we can through communications and using the right communication channels. And it's also important that we provide the easiest access possible. So, for example, some of the mobile vaccination units have had a really a disproportionately high success rate with younger people.
Jonathan Edwards.
Luckily, the Omicron variant was picked up quite quickly in South Africa due to its genome sequencing capability. Otherwise, we could be in a worse position. So what is the British government doing to support international efforts to enhance capability of genome sequencing capability across the world so that the next variant of concern is identified as quickly as possible wherever it comes?
Secretary of State.
Madam Deputy Speaker, I think we can say that we are leading the way on this. The UK Health Security Agency has established a database that is open for all countries to access, to post their data. And even when it came to the discovery of the Omicron variant and the potential risks of it, that was done here in the UK.
Chris Grayling.
Thank you, Madam Deputy Speaker. Could I say to the Secretary of State, echo the concerns about the travel sector and the aviation sector? This is a real blow for them. He will remember back in June, the government took a decision, or July, the government took a decision that it would remove restrictions in the face of heavy scientific advice that he needed to carry on with restrictions. That decision was the right one. Please will he give an undertaking that this time round, he will also face down the more conservative elements of the scientific community, do the right thing and keep the restrictions as minimal as possible.
Chief State.
Yes, I'm happy to give that commitment to my right honourable friend for all the excellent points, reasons he makes. And we were absolutely right back at the start of the summer to open up our country, include to remove travel restrictions. And that is one of the reasons why the UK, when it comes to the dominant Delta variant, is in a much better position than many other European countries today.
Rachel Maskell.
Madam Deputy Speaker, when it comes to public health compliance, consistency and clarity of message is really important. The variant does not understand the difference between an indoor setting on transport to another indoor setting. So why can't the Secretary of State ensure that all indoor settings have the same rules applied to them?
Secretary of State.
Madam Deputy Speaker, I believe that the response we've had is balanced and proportionate.
Andrew Bridgen.
Madam Deputy Speaker, my right honourable friend, the member for Maidenhead, who's no longer in her place, had already confirmed and reminded the House that the normal evolution of a virus is to increase in transmissibility but reduce in pathogenicity over time. Given that the Secretary of State has already informed the House that none of the 336 cases of Omicron confirmed in the UK have yet resulted in hospitalisation, does the Secretary of State agree with me? This is tremendously good news, and we should look forward next week, hopefully, to having all restrictions lifted.
Secretary of State.
Let's see what next week brings.
Martin Day.
Thank you, Madam Deputy Speaker. Several of my constituents have met with difficulties in booking hotel quarantine for the return from South Africa due to problems with CTM being unable to verify certain card payments or to get bookings despite the website showing availability. And as a result, they've missed flights and had to book others in their stead, and that has had to be paid for. Can the Minister therefore commit to reimbursing such constituents for the failures of the system?
Secretary of State.
Madam Deputy Speaker, I'm not aware of course, the details of the individual case the honourable gentleman mentions, but of course, a variety of credit cards and payment systems can be used. If the honourable gentleman believes there's been a failure of the system, I'd be happy to take a closer look at that.
Sir Christopher Chope.
Madam Deputy Speaker, can my right honourable friend tell the House what he's doing to promote the availability of the vaccine damage payments scheme? And does he recognise that that could be a good counter against vaccine hesitancy? But when is the scheme going to be made fit for purpose?
Secretary of State.
Madam Deputy Speaker, we are reviewing that scheme, I think, for reasons that my honourable friend has brought up in the past in this House. And I do agree with him, it is important to have confidence in vaccines, and that scheme has a role to play.
Emma Buck.
Very much, Madam Deputy Speaker. Throughout this pandemic, whilst we have all made sacrifices, we have watched those imposing the rules repeatedly breaking them. The final straw is that last Christmas, as families spent time apart and their loved ones died alone, Number 10 was in full party mode. Can he therefore confirm that the upcoming COVID inquiry will include a thorough examination of any misconduct in public office?
State.
Madam Deputy Speaker, the rules apply equally to everyone.
Paul Maynard.
Thank you. For what reason is the Department for Health and Social Care making announcements on extensions to the red list rather than the Department for Transport, as has been the case previously?
Secretary of State.
Madam Deputy Speaker, the departments across government work together on the pandemic, and that, of course, means my department works very closely with the Department of Transport.
Carl Turner.
Not all, but most members of this House, and indeed the general public, will support the Secretary of State when he says he has to impose further curbs on people's freedoms. But does he not accept that people would be perhaps a bit more enthusiastic if, when he comes back to the dispatch box, he fesses up, accepts that there was an ease up in number 10 last year when people were dying without family members there present with them, fess up to that and apologise on behalf of the Prime Minister?
Secretary of State.
I thought, Madam Deputy Speaker, he was going to make it was going to be a serious question.
Philip Hollowbone.
I have a constituent who is stuck in South Africa and due to come back on Thursday. He's been given an medical exemption from hotel quarantine, so he has to have managed quarantine at home for 10 days. But there's a problem with corporate travel management because they won't let him book his PCR tests for day 2 and day 8 unless he also books a hotel quarantine package. Will the Secretary of State help to unblock the problem with corporate travel management?
Secretary of State.
Madam Deputy Speaker, there are in certain cases, as my honourable gentleman has pointed out, medical exemptions to the hotel quarantine system. The problem that my honourable friend has pointed out, it should not be happening. So I'd be very happy to look at that case with some urgency.
Jack Brereton.
Thank you, Madam Deputy Speaker. I very much welcome the measures that have been taken to accelerate the booster programme. So will my right honourable friend look at what more can be done to support our excellent vaccinators and volunteers in Stoke-on-Trent and Staffordshire to fully roll out as quickly as possible the increased capacity of vaccinations that we need to see?
Secretary of State.
Yes, Madam Deputy Speaker, there's been an excellent rollout of the vaccine throughout Staffordshire, and alongside the rest of the UK, there's going to be a real step up in the number of vaccination access points available.
Richard Drax.
Thank you, Madam Deputy Speaker. Different variants will keep coming us now for the years ahead. And in that regard, I heard a very eminent physician on Radio 4 saying that one area of concern was our reaction to the new variants. Can my old friend just assure the House and the country that we are absolutely on the ball when it comes to a new variant appearing and ready to do all that's needed to regard and keep us safe and safeguard our liberties?
Secretary of State.
I can give my honourable friend that assurance. When it comes to genome sequencing, which is absolutely crucial to identifying new variants and any of the potential risks they may or may not bring, the UK, I believe, is second only to the United States in terms of our capability.
Lord Trott. Thank you, Madam Deputy Speaker. Many of my constituents have been in touch to express concern that they cannot register vaccination status of 12 to 15-year-olds on the NHS app. Can my right honourable friend provide an update of when they'll be able to do that?
Secretary of State.
Yes, that facility, it may not be in the app. There may be it may be through a letter or process, but it will still provide the what's needed in terms of travel for that age group. That hopefully will start next week.
Craig McKinley.
Thank you, Madam Deputy Speaker. I fully understand that my right honourable friend is currently treading water until we know more about the Omicron variant, its response to the vaccines and its virulence. But can I press him as to the nature of any likely government response if those answers are poor? We know what lockdowns mean. It's damage to youngsters, damage to businesses, and damage to lives and liberties, and not least £400 billion it cost until we waited for the vaccine and got it rolled out over a 7-month cycle. Can he please assure me that under no circumstance will we do the same all over again and hope for a different outcome when he knows as well as I that there will be yet another variant sometime down the line?
Secretary of State.
Madam Deputy Speaker, I don't want to prejudge the review, but I know that my honourable friend will agree with me that our best form of defence is our vaccine programme, and the fact that we are doing better than any other country in Europe at our booster programme gives us a really strong level of defence.
Last question, David Johnston.
Thank you, Madam Deputy Speaker. Over 90% of the people getting the most serious care for COVID at the moment are unvaccinated. So does my right honourable friend agree that if people are not getting a vaccine without a good reason, they don't just endanger themselves, they put a strain on the NHS that it doesn't need when trying to treat people for other conditions?
Secretary of State.
I agree with my honourable friend. Taking a vaccine should be a positive decision, and with the exception of NHS settings or social care settings, no one should be forced to take a vaccine. But people who haven't yet taken a vaccine, they should know, as my honourable friend said, that they are not just endangering themselves, but they are endangering wider society. Perhaps that hospital place that they might take would have been taken by someone else with a different illness. And so I would just urge them, just please do think of others.
I thank the Secretary of State for his statement, and we now come to a statement from Minister Kit Malthouse.
With permission, Madam Deputy Speaker, I'd like to make a statement on the Government's new 10-year strategy for addressing illicit drug use.